Good evening, doctor and my friends. Today we are going to make a presentation for VPM 3417 Veterinary Pathology 3 on the interhuman system. We are from group 11. And I am Chong Shu Li with matrix number 1928550.
My name is Ivy Lim Meeting with matrix number 1911625.
My name is Sangari Kurupanan with matrix number 187895.
My name is Nur Hanisa binti Muhammad Shukri with matric number 193108.
My name is Nurul Maisara binti Khairul Faizi with matrix number 193796.
My name is Muhammad Shazrin bin Abdul Ghafur with matric number 192102.
Hi, my name is Mercy Doris Fernandez and my matrix number is 191814.
Okay, let's proceed.
So the case study we get is question 11, dermatitis in animals. There are 4 questions. The first one is name and describe the lesion. The second is what are the differential diagnoses. The third is the most likely agent. And the fourth is the describe the diagnostic procedure. So we will proceed to the first question.
Okay, so I will present the first question, which is name and describe the lesions. So we chose different pictures that is more clearer. And for figure 1, we can see that there is an asymmetrical lesion with irregular borders of blackish crust, and there is also an erosion on the left side of the nasal plenum, which reaches on the left eye. Moving on to figure 2, there is also an asymmetrical and raised and blackish nodule with irregular borders on the right side of the nose. For the histological aspect, we can see in the dermis layer, there is invasion and neoplastic proliferation and infiltration. We can also observe formation of central accumulations of keratin pearls within the invasive neoplastic epithelial cells. So you can see these circular cells, these are the keratin pearls. In the higher magnification, there is fibrosis which surrounds the neoplastic islands, and we can also see high mitotic activity, which is atypical. Okay, moving on to the next question, which is differential diagnosis.
So me and Shazrin will discuss about the differential diagnosis. First, we suspect it is a squamous cell carcinoma because the lesion shown at the nose and on the nose and corner of the eyes, and they are all the squamous cells. Besides that, white and light color cats are more likely to get these tumors. The squamous cells tend to arise in sparsely hair and light pigmented area of the skin, like the nasal plenum and the eyelids. It is very highly variable in appearance. It appears as a shallow or deep sore, a raised, radiant area, or cauliflower-like growth. Next, we suspect sporotrichosis, especially the lymphocutaneous form. It is the most common fungal infections by cats. The lymphocutaneous form of the sporotrichosis appear as a small, firm dermal to subcutaneous nodules, with 1 to 3 centimeters in diameter. It as infection ascends along the lymphatic vessels, clotting and new nodules develop. The lesion ulcerate and discharge a serohemorrhagic acetate. And we suspect it is a sporotrichosis because These fungal infections are often seen on the head, especially on the bridge of the nose and pinna, which you can see the lesion shown on the photo. By the histological pattern, uh, it is the lymphocutaneous form of the spore trichosis is like other fungal infection which with a nodular to diffuse pyogranulomatous inflammatory reaction in both the dermis and subcut tissues, and sometimes will extend into the deeper tissues. Next, Shajun will explain the Bowen disease.
Okay, so we also include about the Bowen disease. Okay, Bowen disease is a multicentric squamous cell carcinoma in situ. Why we include this Bowen disease is because we can found that there's a continuous mass. So the Bowen disease also can be called as intraepidermal squamous cell carcinoma, as it only affect the outermost layer of skin, which is the epidermis. And Bowen disease actually can be found only in the gastric cat, which is above 10 years old. This Bowen disease, it can turn into more serious type of skin cancer if not treated early. And also this is can be differentiated from the squamous cell carcinoma based on its agent, which will be present by another presenters.
So from the differential diagnosis that made by Ivy and Sastrin, I have made out a list of most likely agent that will cause the three differential diagnoses. The first one is the most common one, the ultraviolet light, which can be differentiated into a natural light from the sunlight or an artificial UV light from the UVA therapy. So the DNA will be damaged if induced by the exposure to the UV light. The tumor incidence is proportional to the degree of lifetime sun exposure, especially in the lightly pigmented or white cat in an area that are hairless. The second one is the papilloma virus. Papilloma virus can easily infect the immunodepressed host because immunosuppressions may contribute to the carcinogenesis by reducing the host surveillance and also increase the susceptibility of the keratinocyte on the skin to the infection and transformation by the oncogenic virus. The oncogenic virus is the papilloma virus. The third one is the chemical carcinogen, for example, like the inorganic arsenic, which can normally found in the insecticides and the herbicides, and also the industrial chemical carcinogen, for example, like tars and oils. And the other most likely agent also include the ionizing radiation, the chronic ulcer, serious burn, and also the fungus Sporotrix scancai, which can cause the sporotrichosis in cats.
So,
So we'll move on to the diagnostic procedure.
okay, for the diagnostic procedures, there are a few procedures to confirm the main differential diagnosis. So for squamous cell carcinoma, we have biopsy of that affected specific area, and we also have diagnostic staging test. So in this diagnostic staging test includes CBC, serum biochemical, urinalysis, local lymph node evaluation, a 3-view thoracic radiograph, and also an abdominal radiograph. So for the second DDX, which is Sporotrix, we have a diagnostic procedure of cytology, and we will take samples of blisters or nodules, impression smear of the ulcerated skin, and also smear of swab specimen. And the result should be a yeast-like cells, cigar shaped, but they may also appear as round budding yeast. And the second for sporotrix is a fungal culture in an STA agar. And the third DDX for Bowen disease is just a biopsy. It shows full thickness of the epidermal dysplasia, but there is no dermal involvement, meaning this is only till the epidermis. So I will also discuss about the first diagnostic procedure, which will be fine needle aspiration. So under fine needle aspiration, which can be used in 3 of our DDX, squamous cell, Bowen's disease, and also sporotrix, we have 2 types of techniques, which is aspiration technique and also another technique which is known as fenestration technique. So I will briefly go through about the aspiration technique. What you need is just a needle and a syringe, and so you connect the needle to the syringe and direct that needle into the mass, into that specific area which is problematic, and you draw back and release the plunger a few times. And then you just remove the needle away from the syringe and from the mass, aspirate a few millimeters of air, and then you reconnect back your syringe to your needle, get your slide or your glass slide, and expel the contents into that glass slide. So that is aspiration technique. Whereas for fenestration technique, all you need is just a needle. You're not going to use a syringe to aspirate or anything. So the first thing is you direct your needle into the mass, and then you move the needle in 3 directions to get an actual average sample of the whole lump. So you're actually moving in a few directions and you're making a fan shape. So once you have done moving 3 different directions or more, you remove the needle completely, and you also draw several millimeters of it. This is the only time when you need a syringe. You connect it back to the syringe, and then you expel the needle, the contents onto a slide. So if you can see, there's photos below there on how to do a fenestration technique, and it's very important it's a very good aim towards very small areas of interest. So the next slide will be a much more detailed explanation about how we will do a fine needle an aspiration technique. The next slide. Okay, so as you can see, like I have already explained before, you need a needle and a syringe. You connect both of them, you pierce into the mass, and then you withdraw a bit. And this has to be done several times inside when you are inside the mass, and do not remove out of the mass, like do not come out completely. And after a few withdrawing and returning and plunging, you exit the lesion, you detach the needle from the syringe, and you just get in some air, a few millimeters of air. You retach back the needle, and then you put the smear or the content onto your slide. So that's all from me. We'll proceed to the next procedure.
Okay, now I will explain about biopsy. Biopsy can be used for squamous cell carcinoma and also Bowen's disease. So biopsy is basically when you remove a bit of the tissue and you examine it under a microscope to find out what is wrong, what is abnormal. So there are different techniques to do this, which is punch, incisional or excisional biopsy. And incisional or excisional biopsies are usually performed for diseases of the panicles or for tumors. And then biopsies from the nasal plenum, which is what we are doing in this case, they need deep sedation or anesthesia because it would be quite painful for the animal. Besides that, you also need to know that before you take your biopsy sample, you need to clip the hair near the lesion, but the clippers must not touch the skin surface. If the clippers touch the skin surface, then the area would be contaminated. Also, you must not never scrub the biopsy site, because when you scrub the biopsy site, the diagnostic material, which is the materials that is going to help you determine the diagnosis, will be removed by scrubbing. Now I will explain the general steps in a punch biopsy. First, you'll need to give the animal sedation, and then clip any long hair if it is covering the lesion. After that, you need to give some local anesthesia with 1 to 2% lidocaine subcut with a 25 gauge needle. And be sure to not exceed 5 milligram per kilogram dosage in dogs or 2.5 milligram kilogram in cats. Usually we use a 6 millimeter biopsy punch, but in this case, since it is near the nasal planum, which is very thin, which has very thin skin, we will be using a 4 millimeter punch. Next. Next slide. Okay, after that, once you take the punch, and then you need to place it in the center of the lesion. We need to obtain our samples from the center of the lesion unless it is an ulcer. If it is an ulcer, you need to take it from the margin of the lesion. But since this is not an ulcer, make sure it is at the center of the lesion. After that, you need to rotate the punch in one direction until the blade penetrates all the skin layers and it rotates freely in the subcutaneous layer. If there is blood, you need to blot it with some tissue or gauze, and do not blot on top of the lesion. Next. Remove the punch and then gently grasp the tissue section with the thumb forceps and cut the attachment with iris scissors. Be very gentle in this procedure. After you have obtained your sample, close the biopsy site with simple interrupted sutures or a crochet suture pattern. Next. Next. Okay, this is what we expect to find for squamous cell carcinoma. The picture here is for squamous cell carcinoma. You can see that there are keratin pearls. So this is quite diagnostic for squamous cell carcinoma. For feline bowen disease, which is also called feline multicentric squamous cell carcinoma in situ, it is something that is only found at the epidermal area, and it is usually a disease in old cats, like what Shazrin mentioned earlier. The tumors will appear multiple, they are discrete red, black or brown patches and bumps. Next, I will pass it to my Sarah.
Okay, so for the next technique is impression smear, which can be done to diagnose porotrichosis and also SCC, or squamous cell carcinoma. So to obtain the sample for impression smear, you must do skin scraping by scraping the skin with the edge of the glass slide at a 30 degree to 45 degree angle. And this is very useful for scraping the skin at the pores, the ventrum, the pustules, papules, facial folds, and other areas. So we can also consider to use tape perhaps, which is more useful in some areas that are very dry or difficult to access with a slide, such as the interdigital spaces, facial or tail folds, and periocular areas. So there are a few things that we should take note, which the first thing is you must use a clear cellophane type tape, and then we must press the sticky portion directly onto the area of interest which we want to use as the sample. And the next one, we must stain the sample only by using the stain and counter stain, which in red and purple color. Then we stick the tape directly to the glass slide for evaluation and examination. Next thing is we should note that fixative will remove the sticky portion of the tape along with the sample. So you must be careful. Okay, next slide. Okay, so next technique, which is the fungal culture, which can be used to diagnose porotrichosis. So for fungal culture, we can use Seborrheic dextrose agar or SDA. So the cultures will be examined weekly for up to 4 weeks. We will examine any colonies or growth found on the SDA and examine microscopically for the colonies' features and appearances, such as the size, the color, and the texture of the colonies. We can also examine microscopically to check the characteristics of macroconidia and microconidia. So for example, we can check for the shape, the size, the wall thickness, the wall textures, and the number of compartments or the septae. Next slide. Next slide, please. Okay, so this is a sample from a feline sporotrichosis. From the impression smear from the skin ulcer, it shows numerous cigar-shaped, oval or rounded budding yeast-like organism with a single round pink nucleus that is surrounded by a blue cytoplasm and also non-staining cell wall within macrophages and extracellular medium. So we can see there are like many oval shape inside this. So that is all from us. Thank you.
Thank you.
Thank you.